Dr. Laird, we really appreciate you being here. So we got one more area that we want to talk about, and it is about open communication and emotional support of your loved one as a caregiver. So we kind of touched on that, I think, at the beginning, but it certainly bears repeating.
Absolutely. And especially around this urinary incontinence, I think it sometimes is the last straw, you know.
Yeah.
I mean, everybody who gets older starts having everything happen to us, right? You know,
Yeah.
you're
Seems
changing
like-
and this part stops working and that part stops working. And
Yeah.
and a lot of us, you know, get through many changes and adapt without too much difficulty. But this one sometimes seems like the last straw and can
Yeah.
really be a reason for overt depression, as
Absolutely.
well as social isolation, as we
That's
discussed
huge.
earlier.
Yeah.
And it is. And I really think that to the extent you can as a caregiver, and again, and some of our caregivers are going through these things themselves.
Right.
So I really, really feel for our caregivers who have to kind of, you know, absorb all of this, potentially yourself as well as for another person. But I really encourage you to continue what you're doing, which is seeking out information that can help you, you know, learn more ways to adapt. And that's what I love about what you two are doing is, you know, aging is definitely not for sissies, as it has been said far more famously than me. But I'm always sort of the glass half full kind of person trying to think about, well, what are the adaptations? I mean, I put glasses on at age 13 and adapted without much fuss.
Right.
And if you think about it, that was sort of my body's first foray into aging. Was my eyeballs needed the lenses. So if we can kind of bring it to that sort of normalized level and reduce the stigma that we all have, and I'm hoping that these earbuds reduce the stigma of hearing aids in the future.
Yes.
So if we can all, by talking about this more and by getting more people this information, we can all help reduce that stigma of urinary incontinence. Like, oh, don't talk about that.
Right.
I think, but back to your point, at a personal level, I would understand that personal embarrassment is a huge driver of isolating and, you know, not wanting to deal with something. If it doesn't make sense why your loved one's, you know, not going here or there or blah, 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 it is it's very possible it's related to something that's personally embarrassing to them, because that's human. I would be the same way.
Yeah.
So as a caregiver, as gently and carefully and lovingly as you can, you know, get with your loved one, make it a team effort, make it something that you're doing for each other, so that as challenging as it is to adapt to aging, you want to do it in as successful a way as possible. And here are some steps we can take. We'll do it together. I will help you. One thing I always do with my families that are helping someone who has Alzheimer's disease or a dementia is I always try to talk to them about, as you're thinking of helping someone, think first of, how would I do this so that they can feel and we can be successful in what we're doing? So what are the steps towards their being successful here? And with urinary incontinence, you know what one of the markers of success is? Nobody knows it's happening because of that stigma.
Yeah.
Right.
So what you want to do as a caregiver is say, look, I got your back. I'm going to make sure I'm going to know where the bathrooms are. I'm going to have an extra centi in my bag, or I'm going to also be talking to the doctor to make sure there's not something we're supposed to be doing. And if a medicine is a new medicine, I'm going to say, is there any chance that will disrupt, you know, urinary incontinence or cause urinary incontinence?
Right.
You know, because asking that question, you might get the clinician to say, well, let me double check how these medicines might interact, whereas otherwise they wouldn't have done that. So you giving your loved one that sense of, I got your back on this, and not sort of requiring them to kind of be out there sort of fighting the fight for themselves with this
Right.
extremely personal thing. I know that's a lot on the shoulders of the caregivers. I get that,
Yeah.
but there isn't anyone, we know we need each other. And so what we can do is put programs like this out to help the caregivers, because that's my other plea, is that I hope caregivers, a long time ago, I wrote a book called Take Your Oxygen First. And it's meant to remind family caregivers that amid all this responsibility that we've just given you, and now you've got a bladder diary to write, and you're staking out bathrooms and figuring out, what time it is. In the middle of all that, I want you to take a deep breath. That's a cleansing breath. That's actually a medical act when we take a deep breath like that. It lowers our blood pressure, it clears our mind, reduces stress in that little tiny way. But it's a healthy thing for a family caregiver to do, is to just make sure that amid everything else, they're taking some time for themselves and some oxygen for themselves. This is a good example. You guys qualify as oxygen today for caregivers.
Oh, thank you.
Yeah.
That's awesome.